All right, we'll get started. Hi, everyone. My name is Guy Carmelli, coming to you from UMass, and I'm excited to talk to you guys today about the journal landscape. If you're looking for a talk on ultrasound skills, I think you're in the wrong room, but well,
I can talk on that.
we have a great set of presenters for you that you're going to get to meet in a little bit. But this is a sponsored talk from the Education Research Committee of SAEM. Rebecca is our chair there, and she's going to talk to you a little bit more about that later. But, you know, we as a group meet regularly, and we came up with this idea of discussing the journal landscape so that you know what's out there that you can use to publish. And then we've done other things. We recently published a Pulse article. Who here gets the Pulse, emails of the journals? Great. So go check it out. It was like 2 weeks ago, and it was on this. So it's a good kind of we'll call it the handout to this lecture. How's that? So before we get started, I just kind of want to get to know you guys a little bit. Who wants to publish more? Raise your hand. Oh, good. Okay, you're in the right room. This is the room for the people who want to publish more, so great. Now, I just kind of want a sense of where you guys are at in your publication journey. So who here is, raise your hand if you're in training. Okay. Early career, mid-career, and late career. Okay, so we have a good distribution, so this will be wonderful. So I'm going to introduce our first speakers. We have Rebecca Cole and Danielle Miller, who's going to be giving you guys a brief talk on the journal landscape.
No disclosures. Okay, so my name is Rebecca Cole. I'm a faculty member at the Uniformed Services University in Bethesda, Maryland, so that's the military's medical school. Today we're going to give you a whole menu and variety of journals that you can potentially publish in. We're going to talk about the Jane database, which is a really cool resource to use when you're making that decision. And we're going to talk to you about strategy. So it's not just, throwing a dart blindly at somewhere, hoping you get accepted, but really taking the time to think through a strategic plan for where you submit your work. And then we're going to talk about looking at different multiple journal types and how to publish across those as well. And then we are going to talk about what happens if, worst case scenario, you get rejected, how you can revise and resubmit and be successful the next time. So we know that publishing research is really essential to the profession. We need to know best practices for education within emergency medicine. It's not only good for the profession, it's good for you, because when you publish, that's how you get promoted. However, sometimes it's really hard, especially at the mid or earlier part of your career, to know where to publish, and it's easy to get stuck on that first step of where do I start. So when I think about the selection process, it's kind of like getting a good match if you want to go out on a date. So, you got to really think through this. You don't want to go wrong because it's a waste of time and energy. Just because, something's not a great fit doesn't mean that it's not great. So one way that you can do that is that you can look at the aims and scope of the journal. So all the journals out there will have a link online that says aims and scope. So go there first, take a look, and see if that's a good match to what your manuscript is. If it's not the journal for you, move on. Once you kind of get that locked down, think about the acceptance rate. So if you're looking at a journal and the acceptance rate is like 8%, if you have a super stellar project, the best one that you've ever done, then yes, go for it. Might be a great fit for you. If you want to not, you might want to look in like the 20s, around that area. That can also be another place, especially if you're resubmitting there. And the panel's going to talk a lot about that. I can see Gutley giving me the eye on that. Do you have anything you want to add at this point? Okay. Timing. You want to think about timing as well as you're looking for your match. So is this review, and the journal will tell you how long they're going to take to review and get back to you. Is it going to take 10 days to get that first initial response to you if they think you're a good fit or not, or is it going to take 6 months? So that can be really important when you're thinking about which journal you want to submit to. When you look at the journal, and if you get to this point all the way down the list, then start flipping through the articles that they published, especially recently. Is there one that's just like your topic? Maybe they wouldn't be as interested because you're not going to add a lot of diversity to their set. And then, is it going to cost you money to publish there? So some of these journals have open access fees, looking at maybe even up to $4,000. So if you have grant funding or if your department's willing to pay, then yes, that's a go for it. If not, it might not be the journal for you. And then thinking about your audience. So a lot of my work is tailored towards the military. That might not be for everyone. So think about who's going to read it, who's reading that journal, and we think about that match.
And then I'm Danielle Miller. I am an assistant professor at the University of Colorado. I do a lot of research in technology and assessment. I would say I'm a junior, obviously, faculty and have gone through a lot of failure in this journal publishing and fighting the good fight of trying to disseminate literature. So really, like, these next few slides are a few sort of areas that you can look into in resources. So this QR link got switched at the last minute. So at the end of the presentation, please come up. We'll have the new QR code, but this will give you a list of journals. And when thinking about like journals, I often will think about, man, do I want to publish in an EM-specific medical education journal, general medical education, thinking that's like your academic medicine, your subspecialty fields, like say you did a research project that was on thoracotomy, maybe that's actually a surgical education journal, international medical education journals, and then alternative publication types, like think about your, MedEd portal, et cetera. And we'll get into this. And this resource is truly meant to be like, here are a list of journals that do a lot of education research or publications. And then just to go over like the nuts and bolts of the submission process, we've probably all gone through this pain or will eventually go through this pain of doing this, but it also gives us a sort of common language when we want to ask our panelists on like specific parts of this process and tips and tricks. So again, journal selection, we talked a little bit about that. I'm sure they're going to have some thoughts on pearls and pitfalls there. Formatting, huge deal, boring, but really important. You're going to think about final editing phases. What does that look like? Like, who's doing the final editing? And then cover letter, I think is incredibly an interesting topic that we should also cover today. What can go into a really compelling cover letter? And then, of course, like the resubmission process, like this is a natural process of doing in a journal and making your article better. And so thinking about revising, like how do you do that? What's the time frame for that? Again, journal selection, part 2. Now you've got to pivot. How do you know what's the next journal? When did you decide on that early on? Reformatting, again, a critical part. Some journals will want you to reformat, others, not very few, but some will say they don't need reformatting. And so those are sort of the key areas that we could potentially discuss today. So that is it for this like brief. Let's get to the meat of this with the panel discussion. So I'm going to hand it back to Guy.
All right, thank you guys so much for all that lovely information. So, it's always good in education to, say things in different ways. So it's great to kind of see everything visually. But now let's kind of like have a more of a panel discussion. I also think it's very valuable. A lot of you guys came here with your own questions. Maybe you've had issues or you've faced challenges yourself. So I really have a couple questions that I want to get going, but I encourage you to start thinking about what questions you have, because I have assembled the dream team of the journal landscape here for you, and it's going to be rare for you to have an opportunity to pick some of their brains. So let's start off with some introductions of our all-star team. Mike?
Hi, all. I'm just going to project. So, hi. My name is Mike Gottlieb. I'm in a rush in Chicago. I'm a vice chair of research. I'm an editor for 8 or 9 journals, Annals, Academic Emergency Medicine Education Training, Academic Medicine, a bunch of others. But probably the most important reason I'm here is I failed a lot. Like, I have had a lot of learning along the way, figuring out what works and what doesn't work. And so I'm happy to share with you and help and lend some of my expertise so you can all learn a lot more efficiently and hopefully learn from my mistakes to be even more productive, more prolific, and more successful.
Like, did you turn it on?
I did. It's the
Try.
I know this one was working.
It's best practice.
All right, so you. All right, I'll hold.
Yes.
Hi, I'm Wendy Coates, and I'm so happy to see so many of you here so that we can, further expand our community of education researchers and people who publish in this space. Right now, I'm a decision editor, founding decision editor for academic emergency medicine education and training, and also a decision editor for academic emergency medicine. And reviewer for many other journals, and the associate editor for, drumroll, the Journal of Dance Medicine and Science.
I read that all the time.
I know. Yeah, you should. And like, we publish education articles. But anyway, I'm here as a person who I can probably decorate my office with rejection letters from papers from journals that I thought were a slam dunk at that journal, and then sometimes they got accepted to an even higher journal, including JAMA. Like, we tried the American, whatever it's, the Family Medicine Journal, American Academy of Family Practice Journal, and we got rejected. And so then we're like, well, why don't we just submit it to JAMA, and then we can get some good feedback on what we should have done. And they accepted it. So, I'm just going to throw that out there, and as we continue the introductions, and again, encourage all your questions.
I mean, I think that's a great point. You know what they say, if all your x-rays have fractures, you're not ordering enough x-rays. If you're getting, you really should be getting these rejections, because that's how you're going to get more publications. So good job.
Good afternoon, everybody. My name is Damian Shield. I'm an emergency physician at Boston Medical Center, and I'm an editor for Advances in Simulation, which is an open access journal in simulation. And I'll just comment on the fees. Our journal, you do have to pay to publish. That's because there's no advertising. Aside from that, you probably don't know that if you have no grant funding, you can apply to publish for free. So just because a journal requires a fee doesn't mean you have to pay it. And I'm sorry I have a URI.
And hello, everybody. My name is Michael Casara. I'm at Northwell Health. I'm a decision editor for MedEd Portal in the emergency medicine section, but I do see lots of simulation and other sorts of materials. Just to clarify, I focus a lot, not exclusively on education scholarship, but that journal is an education scholarship journal, not for education research. So we have to make that distinction if that's not totally clear. At least leave today knowing that. But I do peer review, and I am often getting emails from people like Dr. Gottlieb and Dr. Coates and Dr. Shield to get my reviews in on time. So I peer review across the professions, and even in for nursing, PA, and then for simulation and other professions as well.
All right, so now we got a sense of the experience that we have here. I want to start with probably the question that is on most people's minds. I'm thinking of submitting or writing a paper. So at what stage do I need to start considering what journal I'm planning to submit to, and what are the factors that I should consider when trying to pick that journal?
I'll give my 2 cents. I think it's a matter of style, but for me, my style, I always pick a journal first. Really, the first step is doing the work, the design, the project, the collection, the analysis. It's only after I do the analysis that I know what's the story. Then I figure, okay, once we know what the story is, who cares? So if it's going to be a simulation audience or a medical education audience or an emergency medicine audience, and then within that audience, then what's the journal that's going to take? And then pick a place and go for it. So early for me.
I'll just go early is definitely the question. is it research or is it scholarship is the next question. So you can do both at the same time as you're doing your work, theoretically, if you think about it intelligently, but that's at the beginning. That's all I'll say.
And a lot of times projects are more than one paper, so you're picking like which to do first, scholarship and research.
You know, for those of us who don't know, can you just give us a brief, what's the difference between if I'm publishing scholarship or education research?
I'll just simplify, and maybe the others could opine on this as well. Research has a question. What's the question? You answer the question. If you're doing education research, you're doing that in the education space. If you're doing scholarship, think about the materials, the lesson plan, the curricula that you built, the model that you created. If you're wanting to disseminate that, that becomes like educational innovation, which may be research, but could also be packaged as scholarship. If you want to disseminate your lesson plan, your curriculum materials and get it peer reviewed and have it have cachet and have the ability to be used as currency for promotions and tenure, then you would package it as curricular or educational scholarship, and you'd submit to a journal that accepts that. Otherwise, it should be research if it's answering a question.
Great, yeah, because a lot of people, they're doing a curriculum and they're doing program evaluation, and they think it's innovative and interesting, and so they might want to, show that off as scholarship, but it's not specifically answering a research type question.
So something that Guy said sparked something in my mind. He said, let's say you've made a curriculum or you have an innovation, like say your chair tells you, hey, you know what, we need a new program where we train all of our residents, I don't know, like how to do a rectal exam and use the GUIAC card. We had to do that a few years ago where it's like, really? But hopefully yours is a little bit more innovative and exciting than that. And so you have to do a lot of work, let's say, to meet the challenge from your chair to do whatever it is for your department. Well, I would just like to remind you that you should always like double, triple, quadruple dip with your work, that you do the work once and then you do the work so you get like to stay in your job, and then you probably submit it maybe as an abstract or an innovation. Maybe you submit it as a didactic or a talk for your university or the university across town or across state lines. So now suddenly it's regional, which you need to become an associate professor from assistant professor, and then finally you publish it. So if you do any work whatsoever and you don't do the next step, then you're selling yourselves short. And so that isn't the topic of our conversation, but maybe that's how some of these things get into the queue for journal submissions.
That's why we wrote a Pulse article, we're doing this lecture, and stay tuned for our podcast.
So I'll add one more or less piece on there, and then we have a question, it sounds like, to follow this as well. I don't pick one journal. I pick 3 to 5 at the onset. I think it does a couple things. One is it kind of just normalizes the process they're going to reach in your first journal, and I expect that it's not going to accept it. It might get revisions, might get another chance at it, might not, and that's okay. I normalize that amongst our team. Every single paper, every single one we do, we normalize the process that we expect that it's going to go through a couple rounds and potentially a couple rounds of journals, and that's okay. I think when you set that expectation, it's not surprising. It's not like, especially for some of the more junior people on the team that may not have published before, and they're like, I got rejected. You're like, oh yeah, of course it did, because we aimed high. That's normal. And we normalize that process. The second thing is it stops that kind of stunning that normally happens. Once you get rejection, you're like, oh, now what do I do? We've normalized that process. So when it's rejected, I just reformat and resubmit in 24 hours. Now, if there's feedback in there, I'm going to incorporate that, and it might take a slightly longer process, but I'm still just going to go ahead and incorporate feedback and resubmit, and it's a very normal process of that. So by setting at the onset, here are my 3 to 5 journals I'm going to, there's no ambiguity, there's no confusion, no one's looking around saying, what do we do next? We know exactly what we're going to do next, and we're prepared for it, and then it's not so stressful.
I think we had a question. Our associate has a microphone to bring to you.
Thank you. So this gets to the question of scholarship, not necessarily research. And if you're wanting to sort of submit a curriculum that you've developed or a course or something, I've heard conflicting advice about getting or having some data attached to it. Like, do you do a pre-test and a post-test? Do you have to prove the curriculum was successful? Or, can you give some advice around if you're submitting something, does it always have to have numbers?
I don't want to get the reverb in case, so you hold it, but my best advice would be a couple of things. If I was packaging whatever the work product is as scholarship, one thing is look at recently published guidelines by Blanco in academic medicine, the doctrine guidelines, because it should give you a checklist almost, as if you were doing if you do a systematic review, you might go to Prisma. If you're doing educational innovation, and scholarship often dovetails with innovation, it's sort of very similar, I would look at that set of guidelines because there was high correlation between achieving those elements on those guidelines with getting publication in a place like, let's say, MedEd Portal or MedEd Publish, something like that. Sorry? It was the paper on the doctrine guidelines by Maria Blanco et al. 2022. Academic medicine. What I would say is the data. Every journal is a little bit different. So something like MedEd Publish is also a large, well-known international journal for educational scholarship from the the Association of Medical Educators in Europe. So they'll peer review, and then they do the peer review after they do the publication, which is interesting. And if you do the peer review, you actually get a DOI on that also. You get a reference for that as a reviewer. But the data requirements might be different. For MedEd Portal, they usually like to see implementations, at least 2 to 3 implementations of the curriculum to show that you actually vetted it out. So could you get reflective critique according to Glassix criteria that the curriculum works? And then did you have at least 20 or 30 learners in composite? So you had enough learner touches and you had enough implementations. So it's not just a one and done. One day might not do it. That'd be challenging. But did you run it enough times so you can get reflective critique to turn the educational product, the curriculum, into scholarship? It's a rigorous sort of thing. So it's not just building it and doing it, whipping it out there. It's a little bit more thoughtful than that. But I would say, so those numbers sit in my head. A couple of implementations, 2 to 3, the more the better. Multiple learners, multiple learner types. And then the data I would gather is not just the curricular efficacy, it's how did the faculty believe it worked? How did the learners believe it worked? How did the learning environment work? If you had to translate the learning environment differently, all that stuff.
And this has been an excellent question that I've thought of many times, and I've actually talked with Mike Gottlieb a lot about it, and I'd love to hear his thoughts. But a lot of this is kind of really focused on developing a good conceptual framework and let that kind of you can talk more about how that will steer the paper.
Yeah, I want to step back for a second for the comment on outcomes. I would argue that we should be doing outcomes no matter what. If we look at Kern and any other type of curricular design model, we want to know how we did. We want to know, was our curriculum awesome or was it horrible? Did it work? Did people hate it? I want to know that anyways. Whether I'm not going to publish it, I just want to know, how do I make it better? How did our learners do? So we're going to collect that anyways. I think the difference is, are we collecting after the fact because it was an afterthought and oh, this is cool, I should publish this? Or should we think about it at the onset? And so I'd propose that if you're thinking this is something cool I'm going to try out or something I want to publish on, before you've even started the curriculum or before you've started the current iteration of the curriculum, I'm thinking outcomes. And then it just becomes a matter of the scope of the outcomes. How much time do I want to invest in this? How extensive are they going to be? We've done some work that has had very, very extensive outcomes that measure up to 6 months after the course. And we've had some that are just, how happy are you with it? And they can range across that spectrum, and it depends usually to some degree. First of all, where are you trying to publish? Are you trying to publish a study that shows if I randomize someone to one curriculum versus another? Am I trying to get a holistic review of the curriculum, like a program evaluation? Then you can use something called Logic Framework, LGIC, or SIP, CIPP, and there's others out there to try to get this more holistic, accounting for the chaos of the environment, because it's really hard to randomize learners to different groups. Or maybe I'm trying to describe it as innovative. And if I'm focusing on innovation, really I don't care as much about your outcomes. I'm okay if you have soft outcomes from the editor lens. I care about how innovative is this, and I care much more about your reflective critique of yourself. And I went through this process, I learned this. Here are ways we can improve it. Here's why this is innovative and different and novel. Then I care about the rigor and extent and where you got to, I changed the society as a whole with this curriculum. I got Kirkpatrick for the top of the pyramid. It's not relevant. I care about what was innovative. So the key thing I would say is think about your outcomes early, tailor your outcomes to what you want to know for yourself and for where you're going to publish.
Dovetailing on to what Mike just said, for example, in academic medicine, you will find that there are two types of innovation reports that they invite. One is a preliminary innovations report, and the soft data that you need are very, very soft. And the word count is correspondingly very, very low. Because they don't really want to waste their journal space on something that may or may not have actually worked, but that it could spark other ideas in a field that is of interest to the journal's audience. But if you are going to do a rigorous innovations report, they're going to want to have substantial data. And of course, you need more words to do that. So it's another vote for checking out what journal you want to use to submit it to and reading the exact description of what they want for the particular submission category that you want, and then you need to follow it to the letter. As a decision editor, if you submit something and you didn't follow any of the instructions that were spelled out in black and white, then I'm going to wonder if your conceptual framework was done with the same degree of laxity, and maybe not even send it out for review. So those kinds of things are also important.
Yes.
Thank you. Hi, my name is Sohail and I'm from UCI. Wondering what's your stance with the preprint, which is pretty trendy these days. Thank you.
Someone want to start with what preprint is, and then.
I guess I got volunteered in this one. So for preprints in general, just to contextualize, preprint is basically the idea that you're going to post your article, your science online before you're going to submit to a journal. There's a lot of advantages of this, right? Most preprints are open access, so it means anyone can access and see this. For the public, it means they can send the information early. This was something that's been around for quite a while, but it caught a lot of attention over the past 4 years, paradoxically, because COVID. And everyone's like, oh, I want to learn about this new information that could change practice, can improve our patient care. Rather than waiting for the journal processes that are anywhere from 3 months to a year and 3 months. And so this kind of stemmed and brought that opportunity. Now the challenge with this preprint model is that it puts information out there without vetting. And the ideal is that it gets public vetting, that someone goes through and says, hey, wait a second, I have an issue with this, I have an issue with it. Think about like Twitter, but with science articles, right? Someone will go through and you see this trail of things, you're like, oh wow, I caught this thing, and I Googled it and I found this issue. You put something on Twitter in like 30 seconds, or X, sorry. Put something on X in 30 seconds, and all of a sudden there's this flurry of comments that people will critique it. That's what's supposed to happen in preprint. And I think that's actually what will happen in the future when people are more comfortable with it, is we'll actually get that feedback in real time and the conversation goes on. The current version of it is you publish a paper and someone occasionally writes a letter to the editor and you have an opportunity to have that discussion that half the people don't see it because it's separate from the article. But most of the world has discussions on the side and we don't get to get to have that conversation, get to see what other people experience. So in general, I think that's where we're going to go. The key caveat here is, and we'll pass around there, the key caveat really is just if you're going to do preprint, make sure the journal's okay with it. Because some journals will take issue with it. Most are okay with it. Some will. And you don't want it to be rejected because they saw it in preprint.
One of the, there was this trend toward publishing your methods in a separate article. And did that kind of go away? Because I looked to see if I could find a place to try to do that, sneak an extra article, and I really couldn't find places to do it, but I thought it was something that was kind of a trend.
Yeah.
I can't say that I've reviewed in just my peer review work in educational research. Like I've reviewed, I remember, a couple of methods papers. So I'm reviewing that in the lens that that's a research study of the method, like you're trying to really subject the method through a validation process of some sort. In my current work now, I see that mostly in the simulation space with model development. DIY models, build a model, but subject it through a validation process. So I think you can publish methods, but I don't know that that's exactly what you're implying. Like if I did let's say a randomized controlled trial, could I publish out the methods on that? Or is it a methods paper? I'm not sure which. So I have seen that. I don't see how it's a problem. It's educational research if it's among that, but I'll defer.
Yeah, go ahead.
Oh, okay. It's uncommon in meta is the short version of it. In like the biosciences, it's a lot more common because you have NIH funding, and most of these methods ones come in journals that have article processing fees. So you will see it not uncommonly in like larger grant funded studies. Publishing it is less common. The flip side of that, though, is that you should have that somewhere, especially if it's going to be a randomized trial or it's going to be a systematic scoping review, somewhere where someone can actually vet it and say what you said you were going to do is what you did. So it doesn't have to be published. There's open databases like Open Science Framework is a big one. That's very common within medical education. If you do not medical education, the sibling of that one is Prospero. But most of us for medical education will do Open Science Framework.
Hi, Celine Sagalowski from NYU. I think about a lot of the scholarship that we mentor for the house staff, and a lot of it is, curricular innovations or curricular design with lower level Kirkpatrick outcomes, and that's great for their development and their learning, but there aren't, as far as I know, that many curricular sharing resources outside of MedEd Portal where, thankfully for you guys, the bar is quite high to have evaluative data, and that's not in a single small setting. I have my list of sort of brief reports publications or abstracts that I point house staff to, but I'm curious, Curious Channel is one of the ones that I have for curricular sharing. I would love to just crowdsource if you have other peer review locations or homes in mind for curriculum sharing that might not be MedEd Portal, which seems to, be very innovative and singular in kind of what it does.
Yeah, I mean, I can think of the Journal of Emergency Medicine Education and Training, JEM, right? JEM, right? MedEd Publish was the other one I just mentioned before. So those three, then they become MedEd Portal. MedEd Publish, MedEd Publish, and then MedEd Portal. Those three are the ones that are on my hit list for that.
We've had some luck also with residents' perspective. So they might have thought of it initially as a scholarship, but they learned something that's worth writing about, and a figure might summarize their project. And so Dina Khaled, who was at NYU, always said, every paper has a home, you just have to find it. And another idea.
I wanted to talk about every paper has a home for just a minute and highlight something that either Rebecca or Danielle mentioned in the initial thing, the JANE database. So if you don't know what the JANE database is, then just like Google JANE .org or something like that. So basically, this is like a magical, this is magic, all right? So you either enter keywords into this little tiny box, and then you push submit, and then it spits out like 10 to 50 journals that would consider that. And to get an even better appreciation of where it should go, you can cut and paste your abstract into the big box and hit submit. And it'll rank all the journals and how aligned your abstract is with their journal mission, the style, like what kind of methodology you've used and everything else. And so when Mike was talking about, you have your hit list, like, all right, we're going to submit it to this one first, and then when they reject it, we're going to send it here, and then here, and then here. You just normalize that process, and it's really true that every paper that you ever write does have a home, and so I would just JANE is magical, so just go there.
I was just going to say that Jane stands for Journal Author Name Estimator.
Jane.biosemantics.org.
You're willing to go as low as necessary. When you say everything.
Yeah, because like a mentor of mine now, Amelia Benjamin, says a published paper is going to be better than one that's still in your queue that you haven't yet sent out. I think another way to find a journal is think about who you're citing in your paper. So if you're citing that's of interest, that's going to tell you what your audience is, and also the people that you are writing with. Where have they published?
I mean, I guess thinking about the how low do you go, I mean, what are the factors that dictate where you should publish, and are there things you should be cautious of or avoid when looking to publish?
Yeah, so I just wanted to kind of finish the conversation from the person in the back from NYU. Is that where you're from? Yeah, okay. Oh, I was listening. So basically, a lot of people want to have peer-reviewed publications, but your resident might be equally happy to publish it in some sort of a forum, a non-peer-reviewed source that is part of a larger database or something like that. So, or a newsletter, or the Pulse is a great place because there's dissemination within our specialty. So you as a faculty member, you need your peer-reviewed publications to get promoted, but your resident needs to do something and show something so they can take it home to their mom, and they can use the magnet. Yeah, and put it on the refrigerator, like with their name in print. So just kind of keep that in the back of your mind.
Hey, so I'm just kind of pushing back a little bit on the idea that every paper has a home. And while I used to subscribe to that philosophy, I also feel that we have an obligation as editors to raise the caliber of what's being published. And so therefore, we also need to be able to coach our trainees into a better space. And so I'm wondering if you can talk a little bit about resources that you might refer people to if they are either struggling with writing style, if they are struggling with perhaps methodology. So kind of what's your approach to that? Because I think that could be really helpful.
All right, I'm gonna start my approach in 2024, and then what I used to do. In 2024, I think it's a really good use of ChatGPT or some similar large language model. What I do with it is I will put the essay or the section or the portion of the paper in there, and I'll ask it to give me feedback. It's actually really good at that because it has a giant database of that. And you can, if you want to be really savvy, you'll take a similar article that's been published in a journal and say, it's been published here, identify the missing gap, or identify the issues, or identify how I can better frame my question. The more specific you are in there, and you give it an example, it can actually start to identify those trends across there. So I find it to actually be really, really helpful there. Or identify if there's a gap in logic, identify overly complex language, things like that. It's actually very good at picking up. I don't want it to replace my writing. I want it to tell me what I can do differently. And so I think that's one of the areas that's been really kind of helpful for me as I kind of refine writing for the rest of my career. Like, we continue to get better at that. The other aspect that there's a lot of online resources, but I don't think any of that replaces good mentorship. Anytime you're leading a study, you need somebody in your project who's going to be your mentor on that one, especially if it's something that you're kind of junior at. You want the mentor who will redline it. We were giving a talk earlier on grants, and I know some of you were in that talk as well, and I emphasize that a good mentor should redline your grant so it's more red than green than black. The ink is more redded out than it is in black, and that's normal. Someone who's going to mentor you through this should be able to do the same thing to you. You have to have a safe relationship where you feel comfortable, and as the mentor side of things, you have to understand that it doesn't need to be perfect. You need to be able to coach them through it so they're not burnt out. They're like, this is the worst experience ever. But you do need to get that feedback. And I don't know that any online resource will ever replace the one-to-one you have from good mentorship.
I'd like to remind you all that you are in academic institutions, many of which are affiliated with universities, which have departments of education, departments of English, writing, publishing, and sometimes, bringing on someone like that who can help you with the writing could be another resource for improved writing. And there's plenty of style manuals out there that you can also refer to, like Strunk and White is one, and there's other things that are published about how to write and all these other things. So you guys have something.
Yeah. I think academic writing is a gap, amongst clinicians. Certainly, we recognize that. We're big fans of Lorelei Lingard, and did hire her. We have no conflict of interest, but in addition to reading all her stuff, we hired her for a 4-session type of workshop. And so, because I think we do need further training. She starts her course saying, good writing isn't going to fix your study. So I think you're right that we have to have a high level when we start. And so these are all compatible.
They're all of her papers are published in the Journal of Graduate Medical Education, and it's free to download every single one of them. The Writer's Craft is her series that she makes publicly available in definitely urge you to read every single one of them. She has an entire paper about the entire paper, and then an abstract paper and an introduction paper and a method, on and on and on. So that's a great resource.
Just a paper on commas.
Sorry.
Yeah.
One more thing about the mentorship piece. I think it's better for the mentors to be pretty hands-on and actually help with the changes, not just put a big comment saying, rework this. Like when you're mentoring people, do the reworking, put in the citations, help the people out.
I wanted to give you the chance to ask us about revisions.
That's definitely one of the learning objectives we want to talk about. Getting rejected from the journal is part of the process, and Mike had mentioned that he plans for it. So, when that happens, what kind of work are you doing to get it ready for the next, or are you just copy paste into the next submission?
So yeah, this is again, this is expected. I kind of think of the article that goes in and gets accepted right away as the champagne tap. Every once in a while you do an LP and you're like, ooh, 0 cells. But most of the time you don't, right? Most of the time there's something in there and you're like, all right, I have a bunch of red blood cells in here, and how am I going to interpret this, and what am I going to do next? And that's the same thing happens with our paper. You get a bunch of stuff on there. The reviewers bleed your paper a little bit, and all of a sudden you're like, all right, now what do I do with this? Sometimes the comments are, more vague. And I'll look at this and say, all right, what can I pick up from this? What am I going to incorporate? But usually they're pretty good. They'll lay out things. And what I've seen from the editor lens of this, and I don't know how many tens of thousands of paper at this point, or been the editor for a lot of decisions, is that people tend to gloss over it and then just resubmit it. And I think that's a really missed opportunity. The reviewers put a lot of time in that, right? Most reviewers really want you to succeed, whether it's at that journal or somewhere else. Even if they're rejecting it and they're saying you shouldn't be here, if they wanted you, didn't care, they would just say, not a good paper, and move on. The reason you get pages of comments on there, that's work, right? Who in this audience wants to do free work for nothing? No one, right? We want to do it because we think either it's going to benefit us or it's going to benefit someone else. And that's what reviewers are doing. It doesn't benefit the reviewer in any way. It's helping their author. So whether it's going to get accepted or not, they're putting that time in there because they want you to succeed wherever it goes next. And I think it's a service to them not to take advantage of that. So I will take it, look at it, I will put it in a drawer, give myself some time, go through my stages of grief, and come back and do it and be like, all right, now I'm ready to process this. And I'll try to go through it. And some of it's really easy. They're like, oh, you have a typo here, just fix this sentence. I was like, that's super easy, and that's a nice early win. But the ones where you're like, oh, they didn't understand that. my early reaction in my career was to say, they didn't understand that there's something wrong with them. How did they not get this? I said in black and white on my paper, how did they not get this? And being more reflective, they didn't get it because I didn't explain the way they get it. This is an expert in the field who got recruited to review my paper, who spent way more time than the average reader is, and if they didn't get it, the average reader is not going to get it. And so maybe I can explain it differently. So if they didn't understand it, that's an opportunity for me to explain things differently, and then the next reader will get it better. And so I usually try to approach it in the lens of whatever they say is probably right. They may be wrong what they said, but the fact that they got there is something I can improve to help them get to the right place next time.
I'll just briefly add the comment that sometimes a decision is not the champagne tap, but it's the next best thing. A success to me is review and revise, especially if there's no addition that says like no agree of acceptance. Like, so then that's still a win though, as opposed to a flat out decline. Now I have to go to the number 2, number 3 journal. So if in that situation, you may or may not have a guaranteed acceptance there, the review and revise, but they'll give you the 20 to 40, I've seen as many as 100 line items of comments. It's probably in the best interest to not ignore that and take those and figure out how to incorporate those and then work with them.
Once in a while, you'll say, I don't agree, I'm leaving it for this reason. That's fine too, but you address, I agree, revise and resubmit is very generous invitation. They want to see your work succeed, and you don't 100% have to agree. Did I steal your thunder?
You did, but I always have more thunder. So you want to make sure that they get it, that you have seen every single one of the comments that they made. And then you address each one specifically. So I think there's 2 basic ways to do that. One is cut and paste in a Word document and like make spaces. So like here's like your paper did da 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 da, and then you address that point here, and then you skip a space, and then the next comment you address. And sometimes it can be so easy as saying fixed, or like whatever one word will suffice, or corrected, and then sometimes you can, like some journals, academic medicine is one, where they require a formatted table. And even though it's only in some journals, I think it's a really useful way to manage your revisions, where you can cut and paste all of the comments into a table, and then you can kind of assign different ones to different co-authors to address in a Google Doc, and then each one you can say what you've done for each of those comments in tabular form, so that the decision editor just opens that document and reads across and sees what you've done.
Just a quick clarification. I've been sometimes told that we need to write please fix the grammatical error in paragraph 5. Thank you so much for this fascinating and compelling comment. Is that not true? We can just write fixed, period.
All right, so maybe this is like showing my age. Like, I don't like go through, oh, thank you for this insightful comment. I usually personally, and I know that there's people on this panel that I know do it differently, I usually upfront in my letter, dear editor, whatever, thank you so much for all of the thoughtful comments and, the careful review of our study and, blah, 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 like that. Some people choose to say after every comment, thank you for noticing this or whatever. I tend to save that for when they just saved me from like a letter to the editor. Like, how dare you do this? You're so stupid. I can't believe you forgot to, do this important thing and you made a big mistake. And like, I will thank them in that little subset of comments. But I generally write a generalized thank you, and then I just write under each one, what did I do? How did I address it? But you guys might do it differently.
So, for the sake of time, I want to get us out on time. I'm sure our speakers would be happy to take personal questions. I just want to bring Rebecca up one more time to give a shout out to the Education Research Interest Group.
Yes, so if you are feeling like any type of overwhelmed or you want some support in this process, our interest group is the place for you. So we have 600 members who would love to network with you. We meet on a monthly basis, just for maybe 25, 30 minutes. So you could come and find all kind of experts there that you could ask questions to or collaborate with. If you have an idea, you're not sure what to do with it, it's a great place to talk about that and get the ball rolling. So we had someone just come to one of the groups with an idea, and she's now at the point where she's going to have like 10 papers. And she's leading a team of like 20 people right now who are helping her, maybe like 20 institutions as well. So it's pretty cool. So you can sign up in your SAEM membership thing. Just check the box and you'll receive our emails each month about meetings and collaboration and opportunities like that.
Yeah. Thank you so much. And yeah, we'll stick around probably outside if you guys have any questions for us.